I hope you guys having a good day so far, because we have a fantastic honorable guest with us today in the studio. We have the lady behind Pink Ribbon Bali to support the breast cancer awareness to the public in Bali. Okay, Miss Gaye Warren, thank you so much for coming to the studio, and then we're really glad to joining us today.
Thank you very much for inviting me, and it's a pleasure to be here.
Okay, thank you. So so maybe you can tell us a little bit more about yourself and also about the Pink Ribbon Bali.
Okay. Well, my name is Gaye Warren. I'm a British citizen and recent resident of Bali after living 20 years in Jakarta. I'm a breast cancer survivor myself. Following my own treatment for breast cancer 5 years ago, I was inspired to help raise funds for other breast cancer victims in my own country, and I joined a fundraiser called the Pink Ribbon. And that was a Pink Ribbon Walk, and this is actually organised in America, in Australia and other countries as well. And I also raised funds for Breast Cancer Care UK, and my eldest son raised money for the same charity by running a ball in London, a pink ball in London. So on arriving in Bali, I was concerned to find that there was no public education about breast cancer awareness, and no mass screening programs, no support centre for breast cancer patients, and no government funding. So basically the Balinese women were on their own. So as we all know, early cancer detection is the most important weapon in fighting breast cancer, and a lack of awareness of the need for early detection has led to breast cancer becoming the most prevalent cancer for women in Indonesia. So in 2009, I was inspired to found the first Bali Pink Ribbon Walk with the support of Bali International Women's Association. I was a new resident to Bali. I didn't know anyone, and they were there to support me. And so a team of volunteers and myself set up this fundraiser. And the purpose was, of course, to establish Bali's first breast cancer awareness campaign and raise funds for the eventual purchase of a digital mammogram machine. And this effectively screens younger women who have denser breast tissue than older women, because the majority of breast cancer patients in Bali tend to be between the ages of 35 and 45. So it's the digital mammogram machine that Prima Medica Hospital in Sangla would like. So this is our future aim, our aim at the moment actually. Because now 70% of breast cancer patients in Bali visit doctors when they are already in the third or fourth stage of the cancer's development. Chances of recovery in this late stage are roughly only about 30%, whereas if they were to come in stage 1 or 2, they have a good 80% chance of survival. So that's what we're going for. There is, unfortunately, as yet, no cancer registry in Bali, so we're not really sure of figures. However, I am informed that an average of 200 patients are diagnosed with the disease every year at Sangla Hospital. Many women are unaware that they're suffering from the disease. And as I said earlier, they have no education about self-breast examination, which we are taught in the West, and the need for regular clinical checkups. Many are reluctant to go to the hospital. They're afraid to find out they have the disease, and if they don't feel any pain, then they don't feel any urgency to go for screening. And many, of course, harbour a fear of surgery, chemotherapy and radiation. Chemotherapy in Bali is expensive. It costs 1 million for one session, and chemotherapy is not covered by insurance companies in this country. The mammogram machines in Bali are at least 10 years old and need to be renewed and updated. There is only one radiotherapy machine in Bali, which is used for treating between 50 and 80 patients daily. And patients not only come from Bali but from other areas of eastern Indonesia for treatment at Sangla. We also need modern pathology equipment, and there's a shortage of well-qualified medical professionals. And I was also told that the good work done on home hospice care in recent years in Bali apparently petered out due to a lack of funds, and funds are needed also to provide for palliative care and pain management for terminal cancer patients. One thing I would also like to set up through Bali Cancer Care Foundation is a breast cancer support centre for women who have breast cancer and for their families, to be run by Indonesian Balinese people. So that is something that we will work towards as well. So the funds raised from the last three Bali Pink Ribbon walks, one we've just had recently. First of all, we put aside funds to purchase the digital mammogram machine, which we hope, if our fundraising activities and support from outside Bali as well, we do certainly hope that we can try and purchase this new digital mammogram machine by the end of 2012, if all goes well. We do have help from, we've had fundraising from UK, from Australia, and also from Jakarta. And there's one group of Australians in New South Wales who regularly put on a dragon boat race. It's a pink dragon boat race, and they do other events, and they have pledged to put us on their list of beneficiaries for next year. So with any luck, we're going to be able to buy this machine.